Okay, it looks like our numbers are kind of settling in there. Again, I'm Cynthia Bauer with the University of Maryland Center for Health Literacy, along with Michael Villaire from the Institute for Healthcare Advancement, co-host for this conference today. And we're very excited to have our final speaker today, Rohini Kaleem from the I guess AARP. You only go by AARP anymore, right? And so
Yep.
we started this morning, if you've been with us all day, we started this morning with another global organization whose name also begins with an A. And we're concluding this afternoon with another global organization whose name begins with an A. And I think both organizations, you might say, well, they're so big, they're global, they're nothing like me. I'm a little community-based organization here in a small town somewhere. The organizational challenges are quite similar, and maybe the scale's a little bit different, but I'm really looking forward to this talk because when I was talking to Rohini and her colleagues about this, I think they just have some really great insights into many of these common challenges we all have with communicating about science in a clear and effective way. So without further ado, I'm going to turn the floor over to Rohini to talk to us about health policy and global audiences. Thank you.
Thank you, Cynthia, and thank you everyone in the audience. Really happy to be here with you. I actually was going to start by talking about how we are just AARP now, because it used to stand for the Association for the Advancement of Retired Persons. And due to feedback from our membership, we have learned that a lot of our members no longer retire when we think they're going to retire. So we are now just AARP. And I'm going to spend a little time with you sharing a bit about how a large organization like AARP communicates on a lot of these complicated topics around health policy, and advocacy with a variety of audiences, the challenges we face, which I am sure will be very common with the challenges all of you are facing, and then a little bit about how AARP strategizes to address those challenges. And I'm going to talk a little bit about where I work, which is the Office of Policy and Brain Health, and how we've tried to use some of those same tips and tricks to craft a accessible message for our audience, and with a strong emphasis on equity. So in case you are not familiar with AARP, we are the largest nonprofit, nonpartisan organization in the United States. We do have a focus on the 50 and older age group. As I said, it used to be about retirees. And it's all about empowering them to choose how they live as they age. That is sort of our tagline. So aside from the communications arm, the policy arm, we also have AARP Foundation, which is our charitable arm. And we have AARP Services, which is sort of our branding arm. If you've seen commercials about a product that has the AARP stamp of approval, that's our services side. So we are entirely member-driven. Members really do tell us what to do. They pay their dues, and they tell the organization what they are interested in. And thus, all of our products that come out are consumer-facing. And we put out a lot of things. We do a lot of advocacy on the Hill, Capitol Hill, I should say, and in state legislatures, and as I said, products and services. But today I'm going to focus on our sort of literary content. So our print publications and our online content, which is available to the general public, but we do tend to write with an eye to the 50 to 70-year-old population, and topics cover everything from health and fitness, savings, retirement, and then we also have some fun things, like quizzes. We have celebrity interviews, and we do actually a lot around movies and TV and books. So this is just a screenshot of some of our publications. On the left side, you will see what our web pages look like on particular topics. So the health one is front and center. As you can see, it's a lot of consumer-facing information, like phenylephrine is not, in fact, an effective decongestant. So it's a news article about that and what you should do with all the phenylephrine you might have in your cupboard. Questions about the COVID vaccine, etc. In the back, you'll see the sort of front page, which is questions about gas prices, product recalls, information about memes that are circulating in case you've heard about the Karen meme and you don't understand it. There's an explainer for you. And then I've also put screenshots of our actual hard publications that come in the mail. So we have a glossy, which is the AARP magazine. It is apparently the most read magazine in the country. So it usually has a celebrity cover, Bob Dylan here, but with George Clooney, Tom Hanks, Oprah, it's whoever we get for the month, and then there's a bunch of sort of relevant articles. And then in the top right, you see the bulletin, which is if you're familiar with Parade magazine, it's similar to that. It's a little bit more newspaper magazine format, again with a lot of graphics and articles and quizzes to keep you up to date on what's going on. So as you've been hearing all day, there are obviously challenges around communicating around issues of health. And so I'm just going to go through some of the major challenges as AARP sees them, given our size and a bit of our scope. So the first challenge I see as sort of the Raging River challenge, and I know others have brought this up, there is just so much information out there available all the time from everywhere, right? And I know Tracy just talked about ChatGPT, and that's another source now of a river worth of information. So given this, AARP sort of has three challenges here. So the first is we see ourselves as a consumer-facing consumer education organization. So we're first just trying to get everyone across the river. However, you can play with the metaphor however you like, to swim, to take a raft, whatever it is. We're standing there trying to get people across. The second challenge is we would also like to educate them to get across on their own if we are not there. It is a topic where we don't have any information about. We want people to be aware of the fact that they should check sources, that they should understand where information is coming from. So that's the second challenge. And then the third challenge there is we don't want to drown them with more water. So we want to make sure that whatever messaging we do, any communications we give should be short, sweet, get to the point, get them what they need so that they are not then buried under even more information or have further questions. And we want them to be able to rise above it. Another set of challenges that we have is generally how our audience is perceived. Our audience is often dismissed. It's often treated like they don't understand, they're not savvy, they're in a lot of ways they're treated like they are illiterate in issues of health and media resources, finding resources. A lot of times, their concerns get dismissed out of hand, and we have to actively sort of fight ageism while we educate people. And in the health space in particular, we fight a lot around provider assumptions around the health literacy of older people. A lot of our material focuses in on questions to ask your doctor or how to respond when your doctor says X, because we just hear constantly that our members feel very dismissed by the providers out there and the ones that they interact with. And then as everyone has laid out today, and this is of course a universal problem, health messaging is a very complicated thing. There's so much out there, so much patient-specific questions and patient-specific issues, and we cannot obviously address everyone exactly where they are. So it gets quite complicated quickly. And then just to add, even more challenges to our plate. So AARP currently has approximately 38 million members across the country who are getting direct access to whatever communications we put out. But all of our stuff is also free on our website, so the public is also accessing our materials. Then when we frame messaging, we have to think about, the ageism question I brought up. We also have to think about how aging means different things to different people. Because we are also consumer facing, so there's a lot of personal assumptions. You know, they're the people who are completely comfortable with getting older, and then they're the people who get very offended when you mention that they're getting older. We have to be able to write to both of them. Handling cultural beliefs, you know, in the way we address people, in the way we talk to them, how we recommend things, a tone that they prefer, you know, things like that. Generational beliefs. We are now coming up on Gen X is now in our AARP demographic, so they have very different perspectives on aging than their parents and grandparents did. And similarly, millennials are on the horizon, and they have even more different perspectives. So, you know, we'll have to reframe and rewrite according to their needs. And then, you know, there's the American audience. There's also an international audience. American audience, we have 53 state and territorial offices. When we are writing things and we are advocating for things, we have to remember that Kansas and Texas and Maine and Minnesota are all going to have very different needs, or maybe they have the same needs, but we have to write about them differently based on who we are talking to. And even within a state, Albany, New York, and New York City will have very different perspectives, possibly, or a different type of audience. And then lots of global collaborations ongoing, the United Nations, the World Health Organization, all of these large multinational organizations are taking up aging. And of course, AARP is at the forefront of that. But then again, we have to recraft and reframe our messaging to appeal to all of those audiences. So this is what our whole organization is sort of grappling with all the time. So given that, I thought I would just sort of lay out how when we craft messages, you know, what our process is. And it really comes down to sort of these two questions. These are the two questions we ask before we do anything. So the first is, what can AARP provide the audience that is particularly useful to them? And what can we give them that they cannot get elsewhere, right? And so this is that raging river that I was talking about earlier. And I'll give a example, COVID boosters. You know, NIH has a whole lot of the National Institutes of Health, have a lot of resources about COVID and the COVID booster. The CDC has lots of resources about COVID and the COVID booster. But they don't have, so that already exists. AARP is aware that that exists. What they may not have is questions to ask your doctor. How much does a COVID booster cost? What should you know before you go in? What should you know about symptoms that might occur afterwards? So what AARP can do in that situation is sort of collate all of that into a simple list of 10 things you should know before you get your COVID booster, and then also provide links back to existing, you know, scientific or peer-reviewed data about that. So, you know, we would have links to, and if you want to know more about what's in your booster, click this. If you want to know more about what the CDC recommends, click this. So, but we can bring it all into one place, one easy to access guide, and people can go from there. So that is the resource that we provide as AARP. So I also want to talk a little bit about AARP research. And I put this in quotes here because it's not research in the traditional sense. AARP does also do research, as in we look up what things are and what they mean. But we have this really strong accountability function. We as I said before, are member facing, and we are very, very dependent on our members, and we make full use of them. So AARP research is the use of surveys. So we survey all of our members. What we will usually do is, if there is a topic, we will reach out to our members and ask them, have you heard about this? Are you concerned about this? What are you concerned about? Do you like the way we are talking about it? Where have you heard things? So a recent example is long COVID. We've started to do some work around, you know, what our members know about long COVID, what they are concerned about around long COVID. And we find this really effective because our consumer is involved in our messaging right from the get-go. We know what messages are resonating with them and what are not. we are able to test the messages across different audiences because we can really cut the survey data in any direction. We can cut it, racial, gender, socioeconomic status, geographic status. We have political leanings. We have a lot of different ways of cutting our cohort and seeing how messages play out to different audiences. And then we can also target accordingly. And then as part of this as well, we really rely on our volunteer and state executive councils. So we have every single state has a state exec council made up of AARP volunteers, and these are our most gung-ho volunteers, and a lot of them are community leaders, and they will, first we test the message on them, and then they test the message in their communities and with their organizations, and we get a lot of feedback, and all of this trickles back up into how we write and craft messages. So just really quick, some takeaway tips. Really, our very first line is always assume our audience is smart. Anytime we write anything on behalf of AARP, we always write it as if we are sitting down to have coffee with our audience, and they are the same as us, and they have just heard about X, and they're asking us, do you know anything about it? And we always frame it like, why, yes, we have heard of something, and here's some things you should know. We were very, very clear about never talking down. Engineering messages backwards, that's a little bit like what I was talking about with the research. We start with what message resonates with them, and then we sort of craft back up from the consumer level. Avoid the deficit perspective. I will get into this a little bit later when I talk about brain health, but so I'll explain that then. Another key thing is to make our messages fun, memorable, and doable. So a lot of when we put out messaging of any kind, we will also put a quiz with it, or a fun infographic, or a fun little game that you can play. And we really try to just make it so that you cut it out and put it on your fridge. It should be that kind of fun. No jargon. I know someone earlier was speaking about the importance of plain language. We are strong believers in plain language. If jargon is going to be used, it has to be explained and defined clearly. And repeat, just as many times as possible, repeat the core message that you have. So now I'm going to talk a little bit about where I work, which is in the brain health division at AARP. And sort of the very first question we always get is why is it brain health and not something like cognitive decline, or why do we not openly talk about dementia? And this is where this idea of avoiding the deficit perspective comes in. So what that basically means is we don't want our audience to ever feel helpless when we are giving them advice. And we don't ever want them to feel like they are at some sort of deficit. So particularly in the space of cognitive decline and dementia, it's actually a really great example of it is a deficit, literally, but a lot of the stigma is around the fact that it always feels like you can't do anything, that there's a lot of this feeling of helplessness around it. And our brain health messaging is really around, there are things you can do to improve your brain health. We are not in any way suggesting you can cure anything, but these things will help improve your brain health, and they are doable. You are all able to do it. It is totally accessible and doable and inclusive. We really try to talk about things that anyone can do in any place at any time. And you can customize it to your particular needs, your community, your home life. And it should be easy and fun, which again makes it feel doable, makes it feel accessible, makes it feel like you are actively contributing something towards the improvement of your brain health. And just to put a fine point on it, however we craft the messaging, it's always backed up by science. We have a global council on brain health, which is a group of over 200 or so international experts in various aspects of neurology and physical and mental health that we consult with. They put out these scientific reports. They put out they work with us to craft a more normal person friendly report that is not so scientific filled, and we work with them to craft all of the messaging. And then, as I said before, we regularly field and test the messaging across the country and across the world. So here I just have our sort of the 6 pillars of brain health, and this is just to illustrate to you what I mean by sort of how simple and inclusive and accessible we want them to be, right? So everything here is non-prescriptive. It is suggestions. It is things you can do. So we have, we focused on these 6 areas of avoiding social isolation, engaging your brain, managing your stress, exercise, sleep, and eating well. And so these are the 6 pillars. You can do any or all of them, and however much you do, anything you do will help improve your brain health. And then we take the message a step further, and we find something that allows you to do it in a more fun way. So we've been making this huge push around music and brain health. And the way we are talking about it, and this is all true, but music is a way of engaging your brain. So just by listening to music, you have checked one of the 6 pillars of brain health off of your list. Then, if you happen to be with a group of people and listening to music, you are both engaging your brain and you're being social. 2 checked off. We have studies out about how music helps you manage your stress. Again, 2 are being checked off. If you do it while taking a walk, 2 are being checked off. If you use music to put yourself to sleep, 2 are being checked off. And it's, we're not prescribing how much. We're not saying 15 minutes of music and this is what will happen. We're not telling you what type of music. It is entirely up to you. It's customizable. You don't need any special equipment. You don't have to be in a special place to do it. You are listening to music. If you tap your feet while listening to music, that is a win. You have engaged your brain. We want it to be easy. We want people to get into this habit of doing these things and feeling like they are doable, feeling like they've gotten a win out of doing it. And that's really, really important in how we craft messaging. So just back to some of the science, and I won't go through this list, but you can see we have 14 reports, and these are on the left side. These are the scientific reports that the Global Council writes, and we publish and we distribute for free to anyone who is interested. They're available online. We have print copies, etc. But this is the science behind brain health and food, brain health and music, brain health and sleep. So this is the scientific side. And on the other side, we have these sort of more fun single page or half page infographics that we make that tie to the main messaging within those scientific reports. And, this is something you could put on your fridge. We make little postcards, we put them on magnets, etc. And it's just something to hold on to. So this is just a close-up of sort of our overarching infographic, just to show all of these things and how they sort of impact your brain health together, that we hand out. So I just want to take a second, though, to talk about our latest report, which is on brain health equity. This came out in July. And this is a little bit different than usual. This is less on the, hard science and biological science around brain health, and more on impacting policy. This is part of a lot of movements that are going on across the country in a lot of different spheres, but particularly in the space of healthcare infrastructure and the healthcare system. Really, really want to expand literacy around cognitive decline. One of the largest issues that we see in the space of dementia is a lack of diagnosis, and a lot of that is often it's just not being communicated well. It's not being communicated well by the patient, it's not being communicated well by the provider, and there's not a lot of information about what you can do. And a lot of that also just comes down to, honestly, cultural barriers, the same inequities that impact communities of color and other minority groups in everyday healthcare are also obviously at play here. And physicians need to learn cultural competency, cultural humility in speaking to different audiences, particularly those who might have language barriers or other cultural barriers that keep them from fully comprehending what's going on. And then the other thing that I've put here too is that this report really reiterates that number one point that I put before, which is that your audience is smart. And another thing that tends to happen in the space of dementia and cognitive decline is providers tend to start to infantilize people. They just assume now that you have cognitive decline, there's no way you can understand what's happening to you. It's too complicated and you've lost it. And we just really want to reiterate that people can understand complicated topics if they are communicated in an appropriate, culturally sensitive way. So this report is out and contains a whole series of recommendations, up and down the healthcare system, from policymakers, healthcare providers, all the way down to what individuals and advocacy groups can do to help reduce some of these inequities. I just want to take a quick minute to talk about a new direction actually the AARP is taking. And this is it's being called Digital First. And the idea is to move. So what we've been doing in the past decade or so is we have a lot of these papers and paper documents and guides and things, and we've basically just digitized them. And we have now been challenged to start digital. So not take an existing report and just, put it online, but start thinking from a digital perspective right from the get-go so that we make these more sort of interactive features for our consumers. And again, this is AARP research and surveys of our members who have been telling us that this is what they want and what they're hoping for. And it is using AI, and I'm mindful that we just had a really great talk about all the dangers of AI. So this is very much in a testing phase. We are not, and this is not AI in the chat GPT sense so much as creating an experience around existing content. It's not creating new content, if that makes sense. So we're going to watch what our members sort of click on. So if someone has continually clicked on articles related to diabetes and diabetes medication, the digital first system instead will start suggesting, have you looked at diabetes and food, and take them to existing content that we have around diabetes and food, just to help them have a better experience and not force them to sort of search through, again, help them navigate that river and help them navigate the AARP river of information that is there. So this is just a new direction that we have been, we're adopting. So just to close again, some takeaways from our experience at AARP. So always assume that your audience is savvy and smart. You were just sitting down with your friend and you're having a conversation, and that is how we frame every piece of communications that we put out. Avoid the deficit perspective. It sort of ties into that. We never want you, the consumer, you, the person who is receiving this information, to feel like you are lacking in some way. That we are here to help encourage you just to do a little more, and that you're already doing great, and this will just help take you to the next step. Always err on the side of inclusivity. We try really, really hard never to put out anything, that has a solution that's very, very hard for someone to get, or very specific to a particular community problem. We believe all problems are common to our audience, and the solution should also be completely accessible to everyone. No jargon. We use plain language as much as possible, make the learning fun and doable, and encourage them to build a habit. Like I was saying, if you make it as easy as possible, if you make the win as easy as possible, it becomes a habit. And I've just put here also the autonomy to break the habit. We don't prescribe. We do not say you must do this. We never make it onerous, or we try not to make it onerous. And that, if you don't listen to music one day, you're not in trouble with us. This is up to you, and but we encourage you to do these things. We try to make it seem like an easy win. And another thing, we give them a tidbit or an image, an infographic that they can easily remember. Just a really quick anecdote. We get a lot of member mail. As I said, accountability function. A lot of people really appreciate those infographics. Like we'll give them, 5 things to know about a stroke, and we'll get these letters about people who say, I cut that out and I put it on my fridge, and I didn't remember all 5, but I remember the first one, and I noticed that I thought my husband was having a stroke, and I went to the fridge, and in a crisis I was able to figure out what to do thanks to that. So like we try to give them those things that are easy to remember in a crisis or in a happier moment. And then the final thing is just meet consumers where they are and adjust accordingly. So that's how we deal with the variety of audiences that we have and the variety of needs that they come to us with. So with that is the end of my presentation, and looking forward to your questions.
Great, thank you so much. I mean, so many good tips, so much great advice there. We do have one question that's come in, and I'm sure it's one you get a lot. So the question is, what type of pushback have you received about moving to digital tools from non-digital natives? And so that might be, there's a couple of things there in terms of, with your demographic, how many non-digital natives do we even have anymore, right? Because I mean, it was kind of shocking to hear you say like Gen Z, no, Gen X. Gen X is now in your, sorry, not Gen Z, Gen X, sorry.
Right,
Gen X is now in your demographic. I thought, oh my gosh, that's really crazy to think about that. So first of all, what do you think that you even have that many non-digital natives? And for people who really do feel strongly about continuing with print publications, how does that kind of figure into your strategy?
So just to be clear, so we have not dropped the print. We do still have the print, and there is still a system in place actually that we still get tons of actually handwritten letters and phone calls and things like that from our members requesting things, and we have there's like a whole portion of ARP that is the ARP print shop, and it's all of our publications, and you can even go right now and order actual physical copies. So we are absolutely not getting rid of that. What we are trying to do though is 2 things. So one is we don't want to just put that guide online as is, right? And that's sort of what we've been doing, which is exactly word for word, and it's just a web page with that exact same language, and the pictures have just been rearranged. What we're trying to think of is ways for our new audiences, and for frankly our current audience, a lot of whom are extremely tech savvy, a way to make that more interactive, right? So instead of just putting words on a page, now it's like an interactive image. And actually a lot of newspapers have been doing this. I think Washington Post has done this, New York Times has done this, where you sort of, as you're clicking through, an image will pop up or things like that. So we're trying to adapt to those, because we see those in some ways as our competitors, right? They're another really trusted source of news. So our members are looking for that from us as well. So it's an attempt for us to sort of catch up to that and make our product honestly more fun and a little bit less, like you're reading a guide, and a little bit more interactive, and to keep up with upcoming needs of our newer members as they join us, who are very different.
Yeah. And I would have to say, my mom doesn't know I use her as an example, but my mom is turning 90 this year, later in a few months.
Mm-hmm.
And she only became a smartphone user a couple of years ago, and which shocked all of us, right? But she had strong motivation because my daughter wanted to text with her. And, we have all been extremely impressed about all the functions that she has learned. Yes, she still needs some tech coaching from time to time. So I think you brought up this, some of the bad ideas people have from an ageist perspective. I mean, pretty soon there really will not be that big of a difference, right? People will be moving among these different formats, pretty seamlessly if they're not already too. So that might be sort of part of this, like, the notion of a digital native or non-digital native may just kind of leave our vocabulary, right?
Absolutely. And where we are actually is in an interesting place, that some of the information we are providing as ARP in those actually physical publications is things you should know about how to use your smartphone.
Mm-hmm.
When when someone sends you a WhatsApp message, what's the difference between that and, like, what is the TikTok? So
Yeah.
we have all of that going so that, again, you can cut it out and put it on your fridge when your granddaughter calls you, and oh, right, that's what LOL means. And I know that like plays into some of the stereotypes, but it's helping our audience that just needs that little extra something, to get them over that hump.
Yeah. And Audrey Riffenberg put in there, yes, we do need internet access. And I know, this is one of the things that's finally different. I mean, we've had this notion of the digital divide around for like at least 30 years now, right? And the current administration has put a lot of money. I know in the state that I live in, Maryland, there are very major multi-million-dollar investments in helping people get broadband and Wi-Fi access finally, right? So finally some action around the digital divide, which I'm very happy to see. Yeah, so a question. I found it interesting that the Health Literacy Universal Precautions Toolkit recommends that you assume all patients may have difficulty comprehending health information and accessing health services. But AARP flips that and looks at approaching people as smart and savvy. So that was more of a comment. That is an interesting thing because health literacy sort of has kind of had its own many accusations of a deficit model, right? If you I think are very well, no, Barbara, when she was talking about the plain language, said that, for years in plain language, they've been fighting this dumbing down idea. So could you just say a little bit more? Do you think it is incompatible to start to have your stance that people are smart and savvy, but still recognize that people may have difficulty with different kinds of information under different circumstances? Are those incompatible?
I don't think they are. And I think ARP serves actually as a really great model for that, right? So when I say the smart and savvy, I mean, we do. Just to be clear, we do think they're smart and savvy, but it's also sort of the approach in how you frame it, right? So again, with that avoiding that deficit model, you start it as if that take smartphones, that your audience has a smartphone, knows what a smartphone is, and like you never sort of talk down to them, and then you sort of act like the way I was pictured is if two old friends sit down at a table and like, oh, I just got this phone and you have that phone. How do you communicate with your granddaughter? How do I communicate with my granddaughter? And it's more about tone, I would say. I mean, and we try to write at like almost a third or fourth grade level, so we do that. But it's a lot about tone and the way you explain things, and that's sort of why I was also. The thing that AARP brings is, yes, if you're savvy and you know how to use Google, you could find NIH's description of X, right? But you may not necessarily understand it, and you're going to feel a little, oh no, those scientists are saying sciencey things to me. So we will link to it, but we will do the work of translating that into a conversation over coffee with you. And so we assume that you can understand those things, but you might just need someone to talk you through it. And then it's a lot more about framing than it is about actually changing language, if that makes sense. It's a subtle difference, but it's a lot more about how you think about your audience and less about how which then I guess influences how you speak to them, if that makes sense.
Yeah, I always tell my students, I mean, nobody likes to be talked down to. Nobody
Right.
likes to feel disrespected in the way someone's speaking to you and whatever. So it's both just an ethical and a practical stance, right?
Right.
To take a respectful and tone and see your audience as, smart and savvy. So,
right.
So we're going to wrap up in just a minute, but one quick observation I wanted to make before we let you go is, it struck me, you said that, the examples you were providing today were, from the consumer, for your consumer audiences, and that you're a very consumer focused organization. But we know you do a lot of policy and advocacy work, right? I mean, I always get the messages about what AARP is doing to protect Social Security, right?
Right.
So, what struck me with all the examples you showed would be how easy they would be to use with policymakers, because what we heard from Susan from the American Public Health Association this morning was how simple and straightforward your communication for policymakers needs to be. So could you say a little bit, I mean, and it could be related to your brain health work or anything else, just how some of those things might work in terms of policymaker communication?
Absolutely. So we have a really in-depth policy research and analysis team, and they write the sort of wonky stuff that comes out of DC think tanks all the time. They are a think tank. They do a lot of that, but we have a whole thing around policy development. And the point of policy development is to take that wonky language and make it relevant to AARP's perspective, right? So you can learn everything you want to learn. Broadband is a great example, right? So we have researchers who are learning everything there is to learn about broadband in a sort of a broad space. But then we have this policy development angle, which is to take that and put it into language that why it is impactful to our members in particular, right? Why does it matter that AARP should support in front of a legislator, why we should support new policy on broadband? And that is because it is impacting rural elders who don't have access to the internet, therefore can't get their health care, can't do banking, can't do any of those things, right? So there are sort of two arms going at the same time, and one is doing the usual think tank stuff, and the other is translating it. And then what gets translated becomes really nice bullet points for our advocacy team to go talk to a legislator in the 5 minutes that they get and say, it's going to impact these voters, this is why, and they're upset about it. And, and hand them a piece of paper with 3 bullet points about why broadband is something this legislator needs to support. There is a lot of this going on concurrently, and just to be honest with you, AARP is so large it functions a bit like a microcosm government of its own, right? And there's all these pieces doing communications and doing the actual research behind the communications, and then the other research that I put in, which is the survey arm. And is that we talked to some folks in one of our rural states. Is that your concern, or are we framing it wrong? Is that not your concern? Should we be concerned about something else? And all of those are happening together, and then that sort of gets packaged, and that's what our advocacy team will take when they go meet.
Yeah, I mean, my overall takeaway from everything you presented to us today is that AARP is just a very strategic organization, right? I just sense strategy in everything you presented today. And I think strategy is kind of a scary word. Michael Valera and I have over the years sponsored various, strategic planning and strategy sessions and things like that. And we found that like strategy seems a little bit scary to many people. But I feel like your examples today just really show the payoff, right? Both in terms of the organization's effectiveness, but your communication when you're really thinking strategically about these things. And strategic just means like you know what you're trying to accomplish, right?
Yeah.
I don't know if you want to comment on that.
No, and it's, I mean, we will never, I hope I don't get in trouble, but our advocacy team will never go forward without having all of this backing behind them, without having what our research team told them, according to the 50 surveys we ran of members in the following states that said that this is truly what they are concerned about and in exactly this language. And then, the other real research around what those mean so that you know what you're talking about. So you're actually an informed advocate, and they go with that binder completely together to make a case about anything. And it's very, very strategic, to your point. I mean, they would not go forward on something that backing was not there for them to make the case.
Okay. Well, we don't have any more Q&A. Anything else in the Q&A? Michael, did you want to join us? Did you have any comments or questions for Rohini before we let her go?
No, I thought that was a great presentation, and I think we'll recap a few of those things in our closing segment. But outstanding presentation. Really, really appreciate all that you're doing with your organization, and I especially appreciate the alignment with a lot of the things that we do in the health literacy sphere in terms of making sure that things are understandable, actionable, and that's something that we keep really front and center in terms of when we're communicating and when we're preparing materials. So thank you very much for that. Appreciate it.
Thank you.
Thank you for a fabulous presentation, Rainey.